The beautiful thing about disability is that we cut across all strata of society.
Welcome to Disability Clinic, where we want to reframe for people what it means to live with a disability.
Rise up, the time is coming soon.
Part of my teaching, when I teach, inclusive terminology in healthcare, instead of drug seeking, which I absolutely despise, and it just, villainizes our
Yeah.
patients, I prefer pain relief seeking, because that really is the ultimate goal. Like, there's pain, and that's a medical issue that doctors can help people with. And then it's not just fixating on, oh, what medicine are they asking for? It's like, look at all the tools in your toolbox, and it just reframes things.
We don't have to go into a discussion about oxycodone and the people that
The
get
opioid
hooked on
epidemic.
that whole. Yeah. But I take some oxy for a shoulder injury and neck pain. And I take one pill a night just because if I don't, I feel like I'm going through a little bit of withdrawals that keeps me up. And lately I've needed a little bit more because I was traveling a lot and I was using muscles holding myself steady in these taxi cabs. And I have kind of a pattern on how often I refill my meds. I know that I wanted to go down to the pharmacy to pick up one of my drugs because it's Ozempic. And if they mail order it to me, it comes in a big package. And it's like, because you have to keep it cold. And so, as long as I'm going down there, let me see what else I need to fill up. And one of them was, well, I can refill my oxy at this point, but I know that it's much sooner than I normally do it. It's purely out of convenience. I mean, I worry about that. Well, that triggers something to say, gee, they order this much quicker. Are they selling their drugs? Or are they all of a sudden now taking more recreationally? And I got to tell you, this medicine works for me when I need it. And I don't take more than I need. It'll make me spaced out the next morning if I take a lot of it. And there's other ways, especially in California, there's other ways to get high. That way, So, but I have that fear.
I hear you. It's that fear of judgment. And
Yeah.
you're definitely not the first person to express to me, even a pharmacist imposing that judgment or being a gatekeeper, if you will. It really should be between the prescriber and the patient. Obviously, it's like if I have a patient who's going out of town a week early before their fill, like, I can put in the note, hey, this patient's traveling, please fill this today. And usually that's enough. But there are some pharmacists who, they're bringing some past experiences to the table, is always my suspicion. It's like they've had a bad experience, they've been burned in the past, and it makes them on higher alert. Bottom line, it's a healthcare thing. It's standard of care to, be prudent about your prescriptions, and it's a safety thing, but sometimes it can turn into a judgment thing and a bias thing, and that's not healthy.
And here I am, as this older white guy, and I'm concerned about this. And I keep on coming back in our conversation, doctor, about when you're multiply marginalized in healthcare or in society. And I've worked on enough documentaries, I've talked to enough people, I've tried to educate myself. And I think that it's important. Look, I enter DEI spaces on occasion professionally. And I think that it would be easy for people to assume that I only care about people with disabilities when I enter these spaces. And I try to make it clear that no, I'm out here looking at this much more broadly than simply my community. And by the way, disability cuts across every strata of society anyway. So I'm not out here looking for the straight white older guy in a wheelchair disability community. I have this opportunity to create change, and I want to do it in the best way possible. We talk about accommodations, right? For my education, I need an accommodation, or for my job. Well, the question really is, what do you need to do the best job possible? What do you need so that you can get the most out of this educational opportunity?
I love that you frame things that way, because the bottom line for me is always, what does someone need for access? In healthcare, most people come to that conclusion, oh, we're trying to improve access for patients. But as an educator of my peers, I'm also like, what do my colleagues need to access this advocacy bug that you and I get? But how can we get people to understand that when it's not something they've thought about or experienced before? And I do really think that framing things in like, just what does someone need? It's not about their pathology. It's not about their race or their sexuality or whatever. It's about this person needs a clear mask during their healthcare encounters to get the most out of their visit. Or this person needs wheelchair mobility. If we frame things that way, even someone who is complex more than the average person, they will still have their list. They will know what they need. And doctors, it's not simple, but maybe that's the one piece that's missing of doctors being curious about how to accommodate their patients, no matter their disability or other marginalized identity. I think that's a huge missing piece that needs to be incorporated in the standard of how we practice healthcare.
You could have an accommodation for a potential employee or an employee that you have, which is simply, I'm a single parent and my kids got soccer games this fall. So I want Friday afternoons off so I can go to all the soccer games. I'll get the work done, but this is what I need for 8 weeks this summer. Why not do that? Now, if I need a screen reader or I need some software or specific piece of technology, that's going to cost some money. However, what is the benefit of doing that? It goes beyond simply the output of the worker in their, what they're doing for you. It comes down to retaining that employee for a much longer period of time.
And potentially benefiting other employees who might benefit from a similar thing. You're creating an equitable work environment.
And what we often don't think about is you want us at your company. You want us working with you. It's not a one-way street of helping, quote unquote, the handicap. It's about allowing our unique perspective, our creativity, our brilliance to affect the other people around us. And you have to assume that, okay, not everybody's going to be brilliant or like the best person since sliced bread. Boy, is that a horrible mixed metaphor. But you're closing yourself off to people who in their lives probably have had to think outside the box virtually every day. And I believe that my community is known as people who are kind of natural problem solvers.
Yeah, barrier navigators, people who know how to adapt graciously most of the time. I think that's a huge problem in any industry because of cultural ableism. Industries are closed off from this valuable store of knowledge and perspective that people with disabilities have.
But again, how are we looked at in society? And if you look at media, if you look at other things, it's people that are disposable, people that have no value, people that are a burden to society.
I gotta say though, Crip Camp did a lot of work to fight that. You and Nicole deserve so much credit, and all of the people involved in the making of Crip Camp and the movement. I think that documentary really opened up a lot of people's perspectives and heightened their awareness. Even 4 years ago it was released to now, I feel like it's turned a lot of people on to something that otherwise would have no idea about. So I'm just very grateful for that project. And I feel like it really did start a momentum shift in the industry. I don't know if you would agree.
First off, thank you very much. It means a lot. We definitely heard about a Crip Camp effect in Hollywood and that there's an audience for this. And it was authentic storytelling told by people with the lived experience. I mean, I'm very, very fortunate that I had worked with Nicole Newnham before. I worked with her in a bunch of her films. And she said, we should make this film together. And we really crafted this wonderful collaboration. And there's so many other people involved, like you mentioned. But it showed that there are stories out there that have not been really told before, that are very compelling, that are good entertainment, that are all these other things that distributors and streamers are looking for. And it started cracking open the doors to say, I wonder what the other ones are and who are the storytellers and how do we find this? I've worked really hard and co-founded a couple of organizations with other folks that are working to improve access at film festivals, to improve casting so that we have accurate representation. You see maybe 2% or less characters in film and television with disabilities. So people with disabilities make up 25% of our society. Now, some of those disabilities are hidden, but until we really have people moving up the ranks and in the C-suites in the entertainment industry, it's always going to be a bit tougher to get people to understand that it's not as big of a risk to have a show in which there's more than one person with a disability, that your network or streamer can have more than one show around disability. You can have characters that have disabilities that you can see, but that's not the reason that they are in this show.
Groundbreaking. It's groundbreaking stuff.
Yeah, Peter Farrelly had a show called Lucky Hank, and it lasted for one season, unfortunately. But Shannon DeVito is a wonderful actress who uses a wheelchair. She was part of the faculty at this small English department at this university. It wasn't written for her. It wasn't written for a character with a disability. But Peter and his brother, the Farrelly brother, they almost all the time have cast people with disabilities in some role in their films, not because they feel like they had to. It's like they grew up with somebody on the street. They played with them growing up.
It's part of life.
It is. And so we stick out or draw attention to ourselves because we're not being seen. And so it's kind of like priming this pump that's so necessary. The work of the 1 in 4 Coalition to really work closely with companies like NBC Universal to really educate people working there and really kind of talking about how we are engaging with the public when they're producing award ceremonies. This is really important work. Again, it's not just to, like at film festivals, trying to get people to watch films. It's like, I got working professionals who need to have an equitable experience. Not all of us could just jump into Uber and go places. How are you making sure that your festival is accessible to everyone? It's really not defensible at any point now to have a festival where you're using theaters that are not accessible, yet this still exists. The other organization that I've helped found is called Forward Doc, for filmmakers with disabilities working in documentary. And one of the things that we were able to spearhead was a scorecard on accessibility at film events. And our first year report just came out.
I know. I was so excited to work with Amanda, and I connected her with my numbers guy. So I'm so proud of Forward Doc for collecting data on that, because that is a very it's a very valuable piece of information.
You're at Johns Hopkins, right?
Yeah.
This kind of a scorecard, which is extensive, but is collecting such great data, is applicable. And I think you folks there are trying to adapt this structure to really assess what's happening at your organization, at your...
Absolutely. And thank goodness, I got Amanda's blessing, I got Forward Doc's blessing, but that idea, it's so straightforward and it seems very logical, but healthcare doesn't do it yet. We don't concretely collect data on what people need to access their healthcare encounters. It took the film industry, it took storytelling and representation to create that access. And thank goodness that tool is something that can be transferred to so many other contexts and help so many other people. So I'm so excited about the work Forward Doc does and is doing, and just grateful that we can collaborate.
No, it's wonderful. And our organization really followed the path of some other organizations like the Brown Girls Doc Mafia and ADOC for Asian filmmakers. And it's creating community. It is really supporting each other, but then also making sure that we're not siloed and that we really work. And again, we talked about disability. I frame it as, the beautiful thing about disability is that we cut across all strata of society. I really look towards the future of recognizing that perhaps an organization like ours is not exactly the best home for, a gay filmmaker. So how do we work with organizations that are supporting filmmakers within the LGBTQI community to recruit and bring in people with disabilities? Look, 5 years ago and before, I felt like we had to prove that this was important to do. that accessibility was important and that it wasn't just ramps and braille or sign language interpreters, but it was, I want to apply for a grant from your organization. Not everybody really can use a written grant interface as the best way. Doesn't mean that they can't make a film. It just means that your process of deciding who's going to get a grant sets up a barrier that doesn't need to be there. Can this be done by somebody videotaping or recording or doing a phone interview? Why do this? Why not? Why not try to be as accessible to everyone out there? And just because you can't do it the way that everybody, quote unquote, has been doing it before, doesn't mean that you're not deserving or that your opportunity to take advantage of a grant or a fellowship isn't as vital as anybody else's.
And if anything, after all this time, it's like finally we can tap into people who do things a little bit differently. Like we want those perspectives. I want to see those stories. And you're creating pathways for people to be able to do that. And I just think it's wonderful work. Thank you so much for tuning into this conversation. If you want to hear more conversations like this, hit that like button and subscribe to Disability Clinic for more accessible and entertaining education. Thank you so much for watching, listening, and learning.
Rise up,